Hi everyone, welcome to today's class in Docemy. So today we are going to deal with a very important topic in pediatrics, and that is development. The various terminologies, laws of development, the various milestones in the different spheres, and the screening and the confirmatory tests. Now the keywords for today's talk will be maturation of function, loss of development, gross motor milestones, fine motor milestones, your language, social adaptive milestones, hearing, vision, and developmental assess. As always, let's start with a case. A 2-year-old girl was brought to your OPD with history of not starting to walk. She was a term baby with a birth weight of 3 kg. She did not cry soon after birth. Head control was attained only at 6 months, and she started sitting without support at 15 months and standing only 1 month back, that is 1 year, 11 months. She has recently started saying 2 to 3 words, but she is unable to hold a pencil. On examination, she is conscious, alert, her vitals are stable. She has a squint. There is spasticity of all 4 limbs, exaggerated deep tendon reflexes. All other system examination was normal. Now, what is your diagnosis here and how do you go about assessing this child? So this is a question for the day. Before we answer these questions, let's see what we are talking about in this case. Okay, so we are talking all about development. So what is development? In the growth class, we saw how growth goes about. Growth is the increase in number of cells or increase in the size of cells. Okay, when there is a maturation of functions of these cells of the organ systems, you call it development. Okay, so maturation of functions. And what are the main organ system which is involved here? It is your nervous system. So maturation of functions, which is related to the maturation and myelination of the nervous system. So there are 2 important words here. One is the maturation of functions, and second, it is closely related to the maturation and myelination of the nervous system. All of you know that myelination is not complete at birth. It goes on after birth also. That is why your development milestones are attained slowly, and development is closely related to how your brain and the other parts of the nervous system mature and grow. Right. First topic that we'll be dealing with today will be the principles or the laws of development. Okay. So this is a very common question that you get for your theory exams, the laws of development. There are 6 laws of development. Let's see what are the 6 laws of development. First thing, development is a continuous process. So it's very clear, development does not, it's not like, from the stage to this stage you develop and after that you don't. It's a continuous process. Okay, right after birth you attain milestones, go on attaining milestones. Even after you enter your adolescence or your adulthood, there is some sort of development occurring. Okay, not the major milestones, but your cognitive spheres and your behavior, personality, all that goes on developing. Your social factors also goes on developing as age goes on. So it's a continuous process. Right. The sequence is the same, but the rate varies. So the sequence in every child is the same. That means just imagine this topic you're hearing after you know something about developments, you might be able to relate. Okay, so you know that first the child attains neck control or head control. After that, he starts sitting with support. Then he starts sitting without support. Then standing without support, walking, running, climbing stairs. So that happens, step by step. Only the child goes on doing things. A child will not start running even before he starts walking, or the child will not start walking even before he attains head control. Does he? No. So the sequence in every child, if you take child A, B, C, if you take a child in USA, if you take a child in China, or if you take a child in India, all of them will develop in the same sequence. But the rate, some child may, one child may start walking at 1 year, another child will start walking at 1 year, 2 months. There'll be another child who will start walking even at 9 months. So the rate varies between children. So there is a normal range in which you attain that particular milestone. We'll talk about that a bit later in today's class. But then the rate varies, but the sequence is the same. And it is closely related to the maturation of the nervous system, as we already mentioned. Mass activity has to be replaced by individual responses. So as a baby, if you remember babies, their all responses are mass activity and happens in a group. So that has to be replaced by individual responses. And development occurs cephalocaudal. So it starts from head to the bottom. So, okay, so just imagine, first you attain neck control, okay, then your back muscles, you attain your start sitting with support, so all that muscles develop, then you start standing, then you start walking. So first the upper part of the body, development involves everything about the upper part of the body, then only it goes to the lower part of the body. Again, it is proximal to distal, okay, so it starts proximally to distally, right? The last one is that primitive reflexes should be lost before voluntary movements are acquired. So this is very, very important. As you all know, there are a few primitive reflexes like your routine reflex, sucking reflex, plantar grasp, palmar grasp. All these are primitive reflexes that a newborn has. And your asymmetric tonic neck reflex, ATNR. So all these are present. Usually the ATNR and your grasp reflexes are all present up to almost 2 to 3 months. Okay. After 3 months, if they persist, the child will fail to develop new milestones. So suppose, just take an example of palmar grasp. So what is palmar grasp? If you just touch the palmar aspect of the hands of the baby will close his fist. So this is not something that the baby does voluntarily, and that fist is so strong that there are pictures where they show they lifting a baby with just one finger. So it's just a reflex and not voluntary grasp. Okay, by about 3 months the baby loses this reflex, then only he starts having voluntary grasp. Voluntary grasp means you place an object, the baby wants to hold it, then baby voluntarily holds it. Again, plantar grasp. Plantar grasp, when you take your soles, if you touch the bottom of your soles, suddenly all the toes goes into flexion. If that keeps on happening, how will this child walk? He will not be able to walk. Only if your plantar grasp is lost, the baby will be able to keep his feet on the ground straight and start walking. So primitive reflexes should be lost before voluntary movements are acquired. So these are the 6 things. So it's a continuous process. It happens cephalocaudal, proximal, distal. Primitive reflexes should be lost. Mass activity should be replaced, and it's closely related to the nervous system. Sequence is the same, but the rate is different. So these are the 6 laws. Now let's come to another theory question, which is the factor affecting development. So factor affecting development can be factors related to the baby, factor related to the mother, factor related to the environment, broadly. So it could be prenatal factors or antenatal factors, it could be perinatal factors, it could be postnatal factors, it could be environmental factors, psychosocial factors, other protective factors. Now the prenatal factors basically, parents' attitude, intelligence, the environment where the parents are living, okay, and they decide for the child and all that. Antenatal factors mainly GDM, maternal complications, gestational diabetes, but pregnancy-induced hypertension, gestational hypertension as you call it now, the intrauterine infections, okay, maternal pyrexia, chorioamnionitis, all this is going to affect your brain development. So whatever is going to affect your brain development is going to affect the developmental milestones, right? The brain structure is going to affect the developmental milestones. Then you have the genetic factors, chromosomal anomalies, any neuronal migration defects, problems with the brain structure, maternal drug abuse, maternal other complications, hypothyroidism, chorioamnionitis, we talked about that. Then the baby factors antenatally, a low birth weight baby, an IUGR baby, a baby who has some other complications in utero. Then you have the postnatal factors. What are the postnatal factors? Postnatal factors are basically the perinatal factors, of course, difficult labor, prolonged delivery, prolonged second stage of delivery, birth traumas. All these are perinatal factors causing intracranial bleed and all that. Postnatal factors, again, nutritional deficiencies, nutritional, when the child is deprived, child becomes has failure to thrive, an insult to the brain in the form of infections, meningitis, post-meningitic sequelae, or trauma, endocrinopathies, other impairments, and of course the environmental stimulation. Stimulation is very important. So then you have the psychosocial factors where stimulation plays a major role. So lack of stimulation. If you have 2 children born at the same time to the same parents, you put one child in a broken home, you put another child in a home where there are loving parents, both children are not going to develop normally. That is why you see children with problems and developmental problems in who are orphans, who stay in broken homes, juvenile homes and all that. Okay, so parenting is very important. Poverty plays a big role. Abuse, physical and emotional abuse, and lack of stimulation plays a big role in the development of the child. With that, now we go to the proper developmental spheres and milestones. So, we have mainly 4 major spheres of development. Okay, there are 4 major spheres of development. Those are the gross motor, the fine motor, the language, and the social and adaptive. So each of the sphere has to do with some part of the brain and some part of the body. Okay, so gross motor, as the name suggests, it's a gross thing. So it deals mainly with the musculoskeletal system and the brain. So basically the motor part of the brain. So how you start, how your muscles get control, how your agonist and antagonist muscles work, how you start sitting, how you start standing, how you start walking, how you start climbing, hopping, skipping, all those gross movements of the body come on. You can just remember like this. It deals with the gross movements of the body. So sitting, standing, and all those such things. Okay. So these are basically acquisition of skills to facilitate the control of the body and development of locomotion. So locomotion is everything to do with sitting, standing, and all that. So what are the 2 things that are playing a main role here? It's the nervous system and the musculoskeletal system. Then you have the fine motor. Fine motor, you can remember with the term. Finer things. Okay, coordination. Movement of your small hands. Okay, hand-eye coordination. Hand-mouth coordination. All such things. So you have your nervous system there. You have your muscular system there. And then you have the cognitive sphere also there. Okay, and also your cerebellum. That is also coming. That's a very important. Nervous system is there, but then cerebellum is a big part there. Then you have your language. Language, of course, your brain plays a big role. And then you have your social and adaptive. Social and adaptive mainly deals with the interpersonal and social skills. So why do you want to know what all are affected in each or what all contribute to each? Because if you have a child who is having some sort of a problem, some sort of a delay, if you know what sort of a delay that child has, you know what to look for. If you have a child who has only some gross motor delay, that means it has something to do with your brain or your musculoskeletal system. But if there is a brain problem, is he going to have only gross motor delay? He will have fine motor, language, and social adaptive also, no? Because nervous system is there in everything. So it should be something to do with musculoskeletal system alone. So it should be some muscle weakness or some hypotonia which is causing a gross motor delay. That will come to later, but I'm just telling you what is the importance of knowing what systems are involved in each sphere. Okay. Now and of course, before we go to the gross motor milestones, vision and hearing is very important. That's the key. That is why it is a nucleus. It is placed here. Do you expect a child who has no hearing to speak? No. Do you expect a blind child to do all your fine motor things? No. So those are very important inputs for the development of the other spheres. That is why it is very important to ask for these 4. So when you take a developmental history or do a developmental assessment, you have to take the history of a gross motor, fine motor, language, social adaptive. Of course, you have to look for the vision and hearing also, both in the history as well as the assessment. Now coming to the gross motor development. So I know this is a very dry subject. It is very difficult to learn. Every time you learn, you forget. And another thing, many books give different areas. So my reference here is OP Guy and Illingworth, but the milestones are taken from OP Guy because that is a textbook that everyone is following. That is why. But few textbooks give there will be some changes. Okay. Usually the Western textbooks have a bit more advanced milestones. So we'll go with this now. The gross motor development basically talks all about your locomotion. So right from your attaining head control, rolling over, sitting, standing, walking, all such things comes under gross motor. Now let's see the different milestones. So neck holding, also called head control or neck control, is attained usually at 3 months. So it is not just like that simply the child goes and attains head control. There are many things that come before that will be coming to the next slides. But here I am talking only about the major things that are happening. Okay. By about 5 months, the child starts rolling over. So his neck muscles have become strong. He is holding up his neck. Okay. So when you take a 3-month-old baby, he will be able to hold his neck. His head won't bob. So usually head control completes fully formed by 4 months. By about 3 months, mostly head control is there. Sometimes there might be a mild bobbing, but it is completed by 4 months. So if you are asked a single figure for your MCQs, you can say 3 months. Rolling over from your supine to prone. So a baby who's lying supine is turning prone. That is called rolling over. That happens at 5 months. Also, another milestone at 5 months is mouthing, taking your hands to the feet, and then by that time child will have complete head control. Child starts sitting with support by 6 months. So sitting with support. So the tripod position that we'll come to later happens at 6 months, and sitting without support happens at 8 months. Okay, sitting without support happens at 8 months. By about 8 to 9 months, the child starts crawling. So you can, for crawling, you can give 9 months also. If there is 8 to 9, 8 to 9 also you can mark. By about 9 months, the child now the child's head control has attained. He has rolled over. He started sitting. Now he has to stand. Right? Just imagine if you think of your, many of you will be having nieces and nephews at home, or your own children at home. You may have seen some baby somewhere or the other. Just think what will happen. First, the baby will be in the bed. Then the baby will, attain his head control. He'll start rolling over. Then he'll start sitting. Then he'll start standing. Then he'll start walking. Then he'll start running. Then he'll start climbing up everywhere. That is how a baby goes, right? So remember development as a story, or just as a, a picture, a video. Don't by heart. If you by heart, you will never remember. Just remember it as a video. Just at least once, if you have some relative who has got a newborn, or someone, some babies in and around your house or in your hospital, just make sure you see what all they do. That will be there. That will stick in your mind, right? So by 9 months, the baby stands with support. Stands with support means that the details will come to later. He's sitting on the floor. He holds on to some furniture or some objects and tries to stand and bear his weight on the on his feet. By 10 months, he starts creeping. And 11 months, cruising. Creeping means going on his tummy, and cruising means catching hold to objects and walking. You have seen babies catching hold to chairs and walking like that. No? That is cruising. Pivoting. By 12 months, he starts standing without support, tries to walk but falls, so he can walk with 2 hands held. Okay, by 15 months, that is 1 year, 4 months, he starts walking alone and walking without support. By 18 months, the baby runs, he explores drawers, pulls toys. By 2 years, he can walk upstairs and downstairs. So what happens at 15 months? He walks alone. He does not need any support. He can walk alone, and he creeps upstairs. Creeps upstairs means if there is a stairs, he uses his hands and feet and go upstairs. He cannot actually walk upstairs. He'll be on all fours. With his hands and feet, he'll try to go upstairs, and by 18 months, he'll start running. That is the time when all mothers will have a problem. He'll keep on running, and we'll have to run after them. Okay. Another thing he'll do it, he'll start looking at everything. Whatever drawers are there, whatever cupboards are there, he'll start opening, he'll pull out the drawers, put out things, and start looking for things. And also, this is the best time to buy a pull toy. You would have seen pull toys, no? Children, a toy, usually hen or a caterpillar or a train, with all those bells, and there'll be a long twine or a rope which the baby will be pulling around him. Okay, that's a pull toy. So that's the time when they use this. By 2 years, the baby will try to go upstairs. So go upstairs means what happens at 2 years? Usually what they do, they can go upstairs 2 steps at a time. So usually how do we go upstairs? We go upstairs like this. No? This is how we climb stairs. But how the baby will climb? First he'll keep 1 step, then he'll keep the other feet on the same step. Then he'll keep another feet, he'll keep the other feet on the same step. So 2 feet per step upwards, and even downwards 2 feet per step. That happens at 2 years. At 3 years, what he starts doing when he climbs stairs, 3 years he is a bit more confident. Climbing up is easy. Climbing down is a bit difficult. It's scary, Just remember like that. So climbing up at 3 years will be alternate feet per step. So 1 feet, 1 step, second feet, like that. But when he comes down, he's scared. So he'll keep both feet on 1 step and come down. Okay, that happens at 3 years. And at 4 years, what happens? He's very confident. When he goes up, alternate feet per step. When he comes down, also alternate feet per step. So that is all about climbing stairs. 2, 3, 4. 2 feet on 1 step, up and down. This you can remember like this. 2 up, 2 down. 2. 3, 2 up, 1 down. So 2 plus 1, 3. Okay, 2 up, 1 down. Coming down is more scary because when you look from above downstairs, you feel scared, no? People who are afraid of heights. So remember like that. So 2 up, 1 down. At 4, what happens? Alternate up, alternate down. Okay, 1, 2, 3, 4, 1, 2, 3, 4. Right? So that you can remember. Again, at 3 years, another important milestone is riding a tricycle. Tricycle has how many wheels? 3 wheels. So that happens at 3 years. Okay, tricycle. Okay. At 4 years, the child again starts hopping on 1 feet. So hopping is more easier than jumping. or skipping. When you skip, you have to raise both your feet off the ground. So he start hopping. That means on one feet, he'll start hopping at 4 years, and by 5 years, they can start skipping. So these are the major, this is just a bird's eye view of the major milestones that happen. Now let's go a bit more detailed. And so I didn't, till 1 year of age, I did not describe the various milestones because we are going to that in the coming slides. That is why. But now in the coming slides, let's just a bit more detailed about whatever we saw. Now, I told you gross motor has everything to do with the development of locomotion. So, first, the baby, the head control happens, the paraspinal muscles develop, then sitting, standing and walking occurs. So, let's reiterate whatever we told just now. Gross motor development. So, there is something called a 180-degree flip. It's a maneuver that you see for assessment. So, basically, it is for the developmental assessment. Okay, it is not something that you take as a history. It's a form of developmental assessment. It is called the 180-degree flip. You can do it in children up to 1 year of age to see the development. So, usually when you do that, there are 4 maneuvers that you do there. One is the pull to sit. Next is the ventral suspension. The other thing is the vertical suspension. And then you have the prone position. So, these are the 4 maneuvers that you do there. Okay, now let's see what happens in each maneuver. See, supine. So the child is lying on the bed supine. You are pulling him to sit. So how do you pull him to sit? In this video, in this photo, they have showed pulling by the elbow, but don't do that. The elbow might get dislocated. You can pull him like this. This is the best way. Pulling him by the shoulders. Just pull him from the supine position. What will happen in a newborn baby? Newborn has no head control at all. So even when you pull a baby, his head is going to lag, right? Suppose we have a baby here. This is a newborn. Newborn, you know how it will be? There will be no head control, nothing. The baby is just born. What when you do pull to sit? How do you do pull to sit? The 4 maneuvers that we are going to do are, one is the pull to sit from the supine position. So the baby is lying down, he is supine. So you're catching hold of his shoulders and pulling him to sitting position. So what happens? This is a ragdoll. So this is like a newborn. There is no head control. Can you see the head is lagging? Okay, when you pull the baby, the head is going behind like this. So this is the head lag which will be there. Suppose the head control is attained. What will happen when you pull to sit? The head will also come with the body like this. Okay, when you pull to sit, the head will also come with the body when there is head control. The baby will anticipate that you are pulling. Okay, and he will raise his head and come. Okay, so that happens after head control is obtained. And after you put to sit, what all we are looking? We are looking if the back is rounded or the back is straight. So in a newborn baby, the back, there will be no head control. Head will be falling like this. The back will be rounded. As the baby develops and attains head control, his head will be straight. His back will become straighter. Right. So this maneuver is called the pull to sit maneuver from the supine position. Then you have the ventral suspension maneuver. Ventral suspension maneuver is you catch hold of the baby on the palm of the hand. You put the baby on the palm of the hand. So baby will be like this. So this baby is a newborn baby. That is why the baby is lying like this. Okay, in the newborn baby, the head control has not obtained. So his hands and feet will be down. His head will be below the plane. He will not able to lift his head because he has not attained head control. The muscles here are not strong. So this is like a newborn baby. Okay, so but the baby will be moving his limbs. This is a ragdoll, that is why it's like this. But the baby will be moving his limbs. So what happens when the baby has attained head control? He will be able to hold his head in the plane of the body. Okay, and after that, by about 4 months, he will be able to lift his head above the plane of the body. So these are the various observations that you make when you do a ventral suspension. Then you have something called putting in the prone position. So immediately, so you have taken the baby from the supine position. You have taken from the supine position, pulled to sit. Then you have put in the ventral suspension. Then you are putting the baby prone. So if it's a newborn baby, what will happen? The newborn baby's pelvis will be high. The knees will be below the abdomen. The baby will be like this. So as the baby grows up, as the age advances, slowly the knees will get extended, the hip will get extended and the pelvis will come down. Okay, so this is the prone position. And then you have something called the vertical suspension. You catch hold of the baby by both the axilla and vertically suspend him. If the baby has good tone, what will happen? The baby will flex his knee and shoulder, the knee and hip, and the baby will start moving his lips. Okay. So if it's a baby with a poor tone, what will happen? You have something called the ragdoll feeling. So this is the same thing, ragdoll. So you will feel that the baby is slipping through your hands. Or if the baby is spastic, like in cerebral palsy, what will happen? The baby will have, okay, crossing of both the limbs because of spasticity. So these are the various observations that you get. So this is the 180 degree flip that you use during developmental assessment for infants. Okay, right. At 3 months, there will be a slight head lag. So the baby would have almost attained his head control at 3 months. Sometimes there might be a bit of a wobble. Okay, but head control will be fully attained at 4 months. Okay, so OPG gives 3 months, but various books give 4 months for head control. And 5 months, this is from OPG, but for your exams, head control is almost attained by 3 months and completely attained by 4 months. So there's a bit of a discrepancy because of the various textbooks that are there, but I would say, so if such discrepancies are there, I would clearly mention. So I've just put it in the slides because it is from the text. If I don't put that, there will be a confusion, what is the reference and all that. That is why I put in the slides, but usually 4 months is the age of full head control, right? 3 to 4 months, that is. So this is the pull to sit maneuver that is done in a newborn, where you can see the head lag and the baby's head is behind, lagging behind. But here the baby has attained head control. This is a 3-month-old baby. The baby has attained head control and is lifting his head in anticipation. And you can see a baby who has fully attained head control. He is almost 5 months. He can, the head is coming even before the body. Okay. And this is again an older child like that. Now coming to ventral suspension. Ventral suspension is suspending the baby on the hands as I showed. By 4 weeks, the baby will be unable to hold the neck in the line of the body. So the head control has not attained. So the baby's head will be below the plane of suspension. So if this is the plane of suspension, the baby's head is below that. By about 8 to 10 weeks, that is 2 months, the baby's head will be in the horizontal plane. Here you can see, this is the plane, the baby's head is in the horizontal plane. And by 3 months, that is 12 weeks, he'll be able to lift his head above the plane. See, momentarily, this is the baby's plane and the baby is able to lift his head above the plane. So you have 1, 2, 3. Okay, this is 1 month, 2 month, 3 month for ventral suspension. 1 month, baby's head will be below. 2 months, baby's head will be at the plane, and 3 months, the baby's head will be above. Okay, so it is like this: below, at the plane, and above. 1, 2, 3. Okay, right. Now coming to the maneuver where you put the baby in the prone position. At 2 weeks, as I showed, the pelvis will be high and the knees will be drawn below the pelvis. By about 1 month, the baby will be momentarily able, just momentarily, because the head control has not attained. So he'll be only momentarily able to lift his head. So here you can see, this is a newborn. His pelvis is high. Okay, this is like many of us who get up from sleep in the morning. First there are different stages of getting up from sleep. One, your alarm rings, then you snooze it, then again it rings, you snooze it. After 10 times you decide to get up from bed, then you go into a posture like this, right, where your pelvis will be high, knees will be drawn. There you sleep in about half an hour. Again your alarm rings, then you get up, you sit and sleep for some time, then only you get out from bed. So these are the different stages of getting up from bed, usually for all of us. So I go through those stages, hope you also do that. So you will be able to relate that position where your pelvis is high and the knees are drawn behind the pelvis. So that happens in a newborn, and by 1 month, momentarily he'll be able to, he'll turn his head, momentarily he can lift his head above the chin. By about 6 weeks, his pelvis is flat and his hips become extended as I showed. And by 2 months, that is 8 weeks, he will be able to lift his face above the couch. Okay, so here you can see his pelvis has become flat, his hip is becoming flat, but he is able to lift his face off the couch. By about 3 months, he will be able to bear his weight on his forearm. Okay, by about 12 weeks, that is, he will be able to bear his weight on the forearm. You can see the baby here. All of us would have a picture of us at this stage. So there are 2 milestones where our parents take us to a studio. Earlier, now all of us have digital cams and all that. My childhood and parents' childhood, there was this customary ritual studio clicking. Okay, so this was one milestone where we go to the studio. We are put, they give us all sorts of ornaments, and usually without any nappy. And there is this photo. Every one of us will have such a photo in our family album at 3 months, where you are bearing your weight on the forearm. So you can remember like that: 3 months bearing weight on forearm, your picture is clicked, right? And what happens is 6 months? 6 months, the baby, by about 5 months, okay? 5 months, the baby starts rolling over, okay? 5 months, the baby starts rolling over from prone to supine, and by 6 months, from supine to prone. And he lifts his head and greater part of the chest above the ground. So, above the couch, okay? Up to 45 degrees, he is able to lift off the couch. See, this is by 6 months, because he's lifting also, and he's supporting us on his forearm. Okay, that's almost 4 to 5 months here, right? By 7 months, he can turn supine to prone, and by 8 to 9 months, he starts crawling. Okay, and by 10 months, he starts creeping. So what is crawling? Crawling is going on. This is crawling on his abdomen, and creeping is on fours. Okay, crawling and creeping. Crawling is on the abdomen, and creeping is on fours. Right. Now what happens if the baby is pulled to sit? That is what I told you. Okay. First, for a newborn or a 1 month, 2 month old baby, the back will be totally rounded. Okay. By 4 months, the back will become straighter. And what happens at 6 months? 6 months is the time when the baby starts sitting with support. So what is sitting with support? When you put the baby, at 6 months, the baby may not be able to get up from the supine position and sit. When you put the baby to the sitting position, he will be able to sit with his hands on the ground like this. Like this, he will be able to sit. So this is the tripod position. Okay. Tripod position that the baby is going to attain. Okay, tripod position, sitting with support. And by 8 months, he can take this hand off the ground. So initially he'll be sitting like this. After that, he'll take it off the ground. Then he'll sit and play with his toys. Okay, he'll be able to sit and play with his toys without falling. And by 11 months, he starts something called pivoting. So what is a pivot? Pivot means you keep at one point, and from there you keep on moving. So this is pivoting, no? At one point is fixed. From that fixed point you keep on moving. So that is pivoting. So the child will sit like this, he will play, he will turn, sitting itself, he will turn and take things. So this is pivoting. Without even just turning fully, sitting like that, he'll just turn like that. So that is pivoting. So you can see here, the first initially by 2 months the back is rounded, then by 4 months the back becomes straight. This is sitting with support, or the tripod position. If you can see, the baby is sitting with his hands supporting the weight of his body on his hands. By 8 months, what happens? He'll start sitting without support. By the time he'll be able to sit on his own, he'll sit his back is straight, and he's able to play with his toys. This is pivoting. He sits and then turns and takes things. So that is called pivoting. Now, what are the standing and walking milestones? After that, what happens? Weight bearing occurs by about 6 months. So that is the time your plantar grasp goes and weight bearing starts to occur. By 9 months, he'll start standing with support. Standing with support means from the sitting position, he'll hold on to a chair or something, and he'll start standing with support. See, this is not someone is holding him, but usually what happens is they'll hold on to furniture or a stool and start standing with support. And after he started standing with support, what will happen? He will start cruising. Cruising means now he has sit and he is holding onto the furniture and standing. Slowly, he will start walking like this. Okay? He will start walking like this. He will hold on to the furniture and start walking. That is called cruising. And by 1 year, he will stand without support, and he will start walking with one hand held. And by 15 months, 1 year, 4 months, he'll start walking on his own without support. Okay. By 18 months, the child will start running. I hope you remember 1.5 years, he'll run, he'll make the mother run also. And by 2 years, he'll be able to climb stairs and also walk backwards. So the child is standing without support. Here he's walking with 2 hands held, 1 hand held, will be able to climb stairs. See, the baby is climbing stairs. Now let's go through the key gross motor milestones that we told just now. So that is very important for your exam, for your MCQs, your theory, for your clinics, everything. So 3 months what happened? Neck holding happens, completed by 4 months. 5 months rolling over, feet to mouth. So complete head control, I think better you say 4 months. 6 months sitting without support, 8 months sitting, 6 months sitting with support, 8 months without support, and starting to crawl. So crawling, 1 milestone, 9 months. Okay, you can say because it's starting to crawl. This is all from OP guide. But if you get an MCQ crawling, you can give 9 months. 10 months creeping. Crawling means going on the abdomen. Okay, going on the abdomen. Creeping means going on all fours, like an animal, no? Going on all fours. And then you also have cruising at 11 months and pivoting at 11 months. 12 months, walks but falls and stands without support. 15 months, walks alone, creeps upstairs with both his hands and feet. 18 months, runs, pulls a toy. 2 years, walks backwards and going up a stairs, 2 for 2. 2 step, 2 feet a step. Up and 2 feet a step down. 3 years, what happens? He'll ride something with 3 wheels. So he'll ride a tricycle and then 1 plus 2. Going up 1 feet per step, coming down 2 feet per step. And at 4 years, he'll start hopping 1 feet and then going up 1 per step, coming down 1 per step. 1, 2, 3, 4, 1, 2, 3, 4. And at 5 years, child will start skipping on both feet. So these are the various gross motor milestones. Now let's come to the fine motor milestones. So fine motor milestones, I told you, has all to do about your cognition, nervous system, musculoskeletal system, everything about coordination. Hand-eye coordination, hand-mouth coordination and such things. Okay, dressing, undressing, drinking, all such things. That all comes under hand-mouth coordination. Okay, now hand-eye coordination. Usually in newborn, the fists are closed. Okay, predominantly they are closed, and by 2 months, intermittently they open their hands. By 3 months, because unless they open the hand, they cannot catch hold of things. I told you, primitive reflexes should go. By 3 months, hands are fully open and there is voluntary grasp. When you bring something, you keep something on the hand, you take a rattle and keep on the hand of the baby will hold on to it voluntarily. By 3 to 4 months, there is hand regard. So hand regard means the child brings the hand to the midline and looks at it. So if you are asked one thing, you can tell 3 to 4 months hand regard. And by 4 months, again something that happens is the baby bringing both the hands to the midline. When you show a toy, okay, if suppose you are showing a rattle, what happens? The baby will bring both the hands to the midline, but will overshoot that toy or the rattle. Okay, and by 5 months there is a bidextrous grasp. By 2 hands the child is able to hold, and then whatever he holds, he take to the mouth. Okay, mouthing also happens at that time. So usually this bidextrous grasp happens by 4 to 5 months. So if 5 months is not there, you can at 4 months, 4 to 5 months. Again, hand regard also, it happens by 3 to 4 months. So if 4 months is there, you write 4 months. So this is the hand regard as you see it, and this is the mouthing in a 5-month-old baby. Okay, so this is the bidextrous grasp as you can see there. By 6 months, initially they use both their hands. But mind you, at this time there is no hand preference. There is nothing like using the right hand predominantly or left hand predominantly. If that is there at this time, it's a danger sign and it's a red flag and should be looked for. Okay, by about 6 months, what happens? There is unidextrous grasp. They uses one hand to catch a hold of the object, and by 7 months the baby transfers the object from one hand to other. Suppose there is a baby and you are giving the baby something at 6 months you are giving the baby will catch it with one hand. It could be left or right. If suppose you are giving another object to the same hand, what will he do? He will shift this object from, suppose you are giving another object to the right hand, he will shift the object from my right hand to the left hand, and then I'll catch up the object. This is called transfer of objects. Okay, so changing hands and then taking. Okay, that is transfer of objects. By 8 months, there is the radial grasp, and radial grasp means catching hold of objects with the radial part. Okay, so if this is an object, holding like this. Okay, so this is the grasp. Okay, this is a radial grasp. By 6 months, you have the ulnar grasp, which is the immature grasp, and by 8 months, you have the radial grasp. So grasp is basically like this. If you have an object, child will take like this. So radial grasp will be like this, and ulnar grasp will be like this. Okay, that is the only difference. But after that develops a very important milestone, which is known as pincer grasp. So pincer grasp, what is pincer? Using these 2 fingers, this is pincer. Okay, so you are using 2 fingers to take an object. Suppose you have a small bead or some pearl lying down, or some fruits or some dry fruit or something. How will you take this? You take it like this, no? This is called the pincer grasp. So before this is called the mature pincer grasp. So before this, there is a stage called the unassisted, assisted or the immature pincer grasp. So how will the child take that? Child will rest the hand on the ground and then take it. So this is the unassisted pincer. So if the object is here, the baby will rest this hand on the ground and then try to pick up that object. This is assisted pincer. Unassisted pincer means if there is an object, straight away just with 2 fingers he will go. His hand is off the ground. So this is the unassisted or mature pincer, and there is something called casting. What is casting? He gets something, he throws it on the ground. Okay, so that is casting. So these are the various grasps you can see. Okay, so this is the see, immature pincer. The whole hand is rested on the ground, and this is the whole hand taking a small object. The whole hand is rested on the ground, and here you can see the unassisted pincer where you just take it with 2 fingers. Right. Now coming to the hand-mouth coordination, at about 5 months I told you there is mouthing. Everything goes to the mouth. Water, even if you have seen pictures of Hindu gods, there is Lord Krishna on like a banyan leaf. There is this typical picture of him putting his feet in the mouth. So that is a 5-month-old Lord Krishna. Okay, so feet in the mouth. So everything, mouthing happens at 5 months. By 15 months, the baby can take a cup and drink from it. And by 18 months, he can feed himself well with a spoon. So this is the hand-mouth coordination. And hand skills again has everything to do with holding a pen, taking cubes, drawing, turning pages and all that. By about 15 months, that is 1 year, 4 months, he can turn 2 to 3 pages at a time. He cannot turn one page, he'll turn 2 to 3 pages. And by 18 months, he can build a tower of 2 cubes. Cubes will come. By 2 years, he can unscrew lids and he can turn doorknobs, and then he can also turn pages one at a time. Each page he can take. So that is why in younger children, you should buy board books with thick pages. Otherwise, you will not be able to. Now, thin pages one. Okay. Another important question is cubes. Tower of cubes. How many tower of cubes at age? One thing you have to learn is 15 months, 2 cubes. Okay. 1.5 years. 18 months, 3 cubes. 2 years, then it is x into 3. 2 years, 6 cubes. 3 years, 9 cubes. So, 2 into 3, 3 into 3. Okay. 9 years. Right. Here also you can see it is 1.5 years. Right. So, 1.5 years, it is 3 cube. 15 months. 1 year, 4 months, it is 2 cube. So, 2, 3, 6, 9. Right. At 2.5 years, he makes a train with a chimney. Okay. So, train with a chimney. And by 4 years, he can build a gate. 5 years, he can build steps. There is another thing. 3 years, he can also build a bridge. Okay. So, let's see how we can remember that. Okay. So, 15 months, he is currently having 2 blocks. It is like, see, imagine you are building a fortress. Or you are building a fortress. So what there will be a main fortress. Then there will be a moat, like where all the crocodiles will be there in the water. Okay, then you will need a bridge to cross that. Then you will have a big wall with a gate. Remember? Okay. 15 months, the process of construction of the fortress has started. 2 bricks are kept. By 18 months, he is keeping 1 more brick. 3 bricks are kept. By 2 years, he will keep 6 cubes. 6 bricks are kept. 3 years, he will keep 9 cubes. By that time, he has to build a bridge from so the tower is complete. Okay, there will be a tower in the fortress. No, then he will build a bridge at 3 years, and after that they will go and build the gate. Gate is built at the end. So there is a superstition in our place where they say that if you buy a land and you build the gate first, the wall and the gate first, you cannot build a house on that land, it seems. You should build the house, then only you should keep the gate, it seems. There is a superstition like this. So if you have that superstition in your place, you can remember that. First the tower is built, then the bridge is built, then the gate is built. Okay. After that only they will build the steps. Okay, suppose this fortress is on a big mountain. You have to build steps also, no? So first you build the tower, then you build the bridge, then you build the gate, then you build the steps. Okay, so 15 months, 2 blocks, 18 months, 3 blocks, 2 years, okay, 6. You can also, when the tower is lying on the ground, it will look like a train. So 6 cubes, whatever. 3 years, 9 cubes. 3 years also you will build a bridge. 4 years you will keep the gate, and 6 years you will build the steps. Okay, right. 5 years, 5 to 6 years is what books give for steps. 5 to 6 years. Another thing here is the drawing. So how do you imitate or copy? Okay, at 3 year you copy a circle. 4 year it is a plus or an into. 4.5 years you draw a square. Okay, 5 years it is a triangle. By 7 years, 6 to 7 years you can draw a diamond. So these are the ways. So how do you remember? So again, we told about scribbling. At 15 months, usually the child scribbles. He holds a pencil like this and he scribbles. By about 18 months or 1.5 years, he can draw strokes. So what strokes will he draw? Which is easier, vertical strokes or horizontal strokes? Vertical strokes are easier. So initially he will draw a vertical stroke. Then by 2 years, he will draw a horizontal stroke. Then 3 years, he will copy a circle. 4 years, he will copy a plus or a into. 4.5 years, he will copy a square. 5 years, he'll copy a triangle. Okay. By 6 to 7 years, he will copy diamond. So does this look like a man to you? You can just put 2 eyes, smile. Okay. Does this look like a man to you? So this is 18 months, 1.5 years, 2 years, 3 years, 4 years, 4.5 years, 5 years, and 6 to 7 years. Okay, 6 to 7 years. Diamond. So hope you can remember it that way. Now, dressing is also part of the fine motor skills. So what happens at 1 year, if you have seen any 1-year-old baby, he'll pull out everything that he's wearing. You will not be able to put a cap, you will not be able to put a socks on that baby. He'll pull out everything. So he pulls out his mittens, caps and socks. By 18 months, he'll be able to unzip. You put a jacket, he'll put down the zip. He'll be able to unzip, but he cannot button properly. By 2 years, he can remove all his dress completely. But he will not be able to dress. He can remove everything. By 3 years, he'll be able to dress, but he'll not be able to put his buttons. Someone has to help him with the buttons. By 4 years, he'll be able to put his buttons also. And by 5 years, he'll be able to put his shoelace. That is why usually if you go to any shoe shop, especially the school shoe shop and all, you can see that, especially Bata and all that, above 5 years only from 6 years and above, and you will get shoes with laces. Till then, you have only Velcro shoes. You don't have laces because the child will not be able to tie his shoelace up to 5 years. So you can remember, children only after first standard they'll be able to tie. Okay, till first standard, LKG, UKG, they have to wear Velcro shoes. Okay, right. Now let's just have a quick recap of the fine motor developmental milestones. 5 months bidextrous reach. Before that, hand opening, hand regard, voluntary grasp is there at 3 months. 6 months, unidextrous approach, transfer of objects happen at 7 months. 9 months, immature pincer grasp. Okay, 12 months, that is 1 year, mature pincer grasp. 15 months, scribbling, 2-block tower. 18 months, again drawing a vertical line and tower of 3 blocks. 2 years, these are just strokes. Okay, they can draw horizontal line and the circular stroke. Stroke is different. So you didn't learn this. You can learn this horizontal stroke. And then by 3 years, tower of 9 block, copy circles and build bridges. 4 years, copies a cross or a plus and a gate. And by 5 years, he can copy a triangle, and 5 to 6 years, he can make steps with blocks. Now going to our third milestone, which is the personal and social development and the general understanding. So here it has everything to do with the social interaction. Interaction with mother, interaction with the environment, peers and everything. So usually there is something called a spontaneous smile. It's also called an angel smile. So that is not something in response to seeing a face or hearing sound. So that is called an angel smile. All babies have that. The major milestone will be fixation. Okay, looks intently. Can you see the mother when the baby is crying or the baby suddenly someone goes and talks to the baby look at his face like that. So looking intently at the mother. It needn't be the mother. It could be anyone. Okay, right. By about 2 months, the baby will have a social smile. So that is a very, very important milestone. Social smile. Social smile means baby is responding to you. Okay, when you play with the baby, you talk with the baby because he is interacting with you. It is not a smile like the angel smile where he is simply smiling. He is not understanding what you are doing. He is looking at you and in response to your interaction with him, he is smiling. So that is the social smile. At 3 months, he will be able to recognize his mother. He can anticipate feats and he looks around. So that is the time when mother regard comes, when he starts recognizing his mother. By 6 months, when he given a mirror, he can look at the mirror and laugh at it. Okay, he will be looking at his mirror image and laughing at it and imitating act. By 7 months, a major milestone which is stranger anxiety. Till then, what happens? Where he'll go for it, everybody, your baby, he'll jump into others' hands. 7 months is a time when it is very difficult. You cannot go to a mall, you cannot go for a wedding, you cannot go anywhere. Baby, once he sees strangers, he'll start crying. So that is stranger anxiety. By about 9 months, he says bye-bye, waves tata, bye-bye. 12 months, he plays simple ball games. 15 months, he'll start pointing to things which is interesting. If you want something, he'll catch hold of your hand, he'll take there and start pointing. That happens at 15 months. I'm sorry, you have to learn all this. You can just remember it as a story, just like a video of a child, like seeing the flashback. In old movies, there used to be this flashback. So you can just remember it as a flashback as you grow up. By 18 months, this domestic mimicry, very difficult. If the mother takes the broom, baby will also bring a broom. The mother does something, baby will also bring. Father takes a shaving kit for shaving, baby will also take it. So that's domestic mimicry. And when you ask body parts, where is your nose, where is your lips, where is your ears, he will show that also. Please don't ask him big things like metacarpal, carpal and all. Ask him small things. Where are your lips, where is your nose, ears and such things. Right? Okay. So next time you go to the ward and you see a baby, don't ask all these medical terms. Ask small things in your local language. Okay. At 2 years, what happens? That is the time he'll start showing off. Now he'll pull everyone. He'll show all his toys. See, but he'll not give any toy. He'll show all his toys to whoever comes home. He listens to stories. Very important. He can name 2 to 3 objects at that time and point to 3 to 4 body parts. Okay, and he'll tell you when he has to go to the toilet. At 3 years, he'll start beginning to count. He can identify 2 colors. He'll know his full name and gender, male, female, and his full name. So, name and gender at 3 years. 4 years again. So, 2 years, there is another milestone which is known as the parallel play. Okay, parallel play means when someone comes home, he will sit with the child and play, but that child will be playing with his toy. My child will be playing with my toy. So, that is parallel. They will sit together, but they will be doing their own jobs and playing separately. But 4 years, they have something called a group play. They'll sit together, they'll share their toys and play. So that is called the group play. And then you have the left to right discrimination and they can go to the toilet to know. 5 years, they can follow 3-step commands. You take this, go there and keep there and come back. So you're giving 3 instructions at a time. So there is a 3-step command. They can identify 4 colors and 4 digits at 5 years. Now the key social and adaptive milestones: 2 months social smile, 3 months recognizing mother, 6 months mirror, looking at the mirror and smiling, 7 months stranger anxiety, 8 months object permanence. We'll come to that when we come to the vision also. 9 months waving bye-bye, 10 months peekaboo. So peekaboo is, you close your eyes, you count and then you look. So that is called peekaboo. You don't count here, you close, the child will take off your hand. You close, child will take off your hand. That is peekaboo. That happens at 10 months. You can play with the child. 12 months, ball game, casting, give kisses. Okay, 15 months, he'll tell you. After urination, he'll tell you. See, I've wet my pants. At 18 months, he becomes dry by day usually. There is domestic mimicry. By 2 years, he is a show off. He pulls and shows things to everyone. There is parallel play. 3 years, he is usually dry by night. He knows his full name and gender. 4 years, group play. He can go to the toilet alone. 5 years, he helps in household tasks, dressing and undressing. We already told. 3-step commands, 4 digits, 4 colors. Right? Now coming to the 4th developmental sphere, which is the language development. So you have both receptive language and expressive language. So at 1 month, the baby is alert to sound. So when the baby is sleeping or the baby is crying, suddenly he hears a big sound, he stops crying, he startles. Okay. Then by 6 weeks to 8 weeks, there is vocalization. Baby start, baby start making such sounds. By 3 months, there is something called cooing. Ooh, 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 ooh. If you have babies at home, if you have babies at this age, you will see them. Cooing. Okay. 4 months, he'll start laughing aloud. So that is a very, very nice time. You can really see those small dimples and he'll start laughing aloud. Even this baby, see how cute this baby is. 5 months, he'll start making sounds. And 6 months, important milestone, monosyllable. So, ba, da, pa. Usually what happens is when they make the sound, mothers feel that he's calling mama or amma, whatever. Right. So that's not amma, amma. It is just ba, da, monosyllables. 9 months, there is bisyllables. That means mama, dada, baba. Okay. And by 18 months, he says 1 to 2 words with meaning. Father, mother, and other 1 to 2 words with meaning. By about 18 months, that's 1.5 years, he knows up to 8 to 10 words. Okay. He knows how to name a few people at home, animals and all that. By 2 years, he says 2-word sentences. 2 years, 2-word sentences. 2-word sentences is, if he wants a glass of milk, give milk, bring that, mon, me water. So he can tell nouns also, I, me, you. So in your language, whatever it is, he will tell. Okay. 3 years, he knows his full name and gender, we told. So he can tell that. 4 years is the best time when you can hear stories and poems. That is the time you send the children to Anganwadis, There they teach poems, they tell stories and they'll come back and tell you at home. And 5 years, he'll start asking things. That is a very problematic time. Anything he'll start asking meanings. Okay. So language milestones: 1 year alert to sound, 1 month alert to sounds, 2 months vocalization, 3 months cooing. So musical sound. 4 months laughing aloud, 6 months monosyllable, 9 months bisyllables, 12 months 1 to 2 words with meaning. 15 months jargon. He'll go on talking. He'll come and scold you, but you will not understand a word. He's speaking in his own language. So that is jargon, which happens at 1 year, 4 months. 18 months, about 10 words. 2 years, 2-word sentences. 3 years, he'll ask questions, knows name and gender. 4 years, he sings songs, poems, stories. 5 years, asks meaning of words. Now coming to vision and hearing. So I told you, vision and hearing are very important. So vision, what all he does, at birth the baby can fixate and move up to 45 degrees. Suppose the newborn is there, you show a dangling ring, a red ring, what will happen? The baby can follow. If you move that ring from here to here, up to 45 degrees, the baby can follow. By about 1 month, he can follow up to 90 degrees. And by 3 months, he can follow up to 180 degrees. When someone is going like this, he can look without turning his head, he can move his eyes like this. Okay, right. Now, object permanence. We spoke about this earlier. So, what is object permanence? Object permanence is basically that the baby is able to locate a thing which is kept hidden, and that happens at 9 months basically. So even before that, at 4 months, there is a binocular vision which is well established, which happens by, it starts by 6 weeks and it's well established by about 6 months. Okay, you can tell 6 months. And by 6 months, he can adjust his position to follow objects, and the visual acuity of an adult develops by 6 months. 1 year, he can follow rapidly. So by 9 months, he has object permanence. Suppose I take a ball and I hide it under the sheet, the baby sees that the ball, even after removing that ball from under the sheet, the baby will come and look under the sheet. So he thinks that the object is permanently there. So that is called object permanence, and that happens at 9 months. Coming to hearing, newborn, usually what happens, newborn, when they hear a loud sound, they will start crying, or if he is crying, if he hears mother's sound, he'll become quiet. By 3 to 4 months, he'll start turning his head towards the sound. So when he hears a sound, he'll start turning towards the sound. By 5 to 6 months, if the head is turned, so this is upwards. Okay. So if suppose you ring a bell or they hear a sound, what happens is at 6 months, the baby will turn the head and then look up. Okay, so that happens in 6 months. Suppose you make a sound from below, the baby will turn the head and then look below. How do we see when we hear a sound? We immediately look there, no, diagonally. But babies at 6 months, when you hear a sound from above, they'll turn the head and look up. From below, they'll turn the head and look down. And when diagonally, they'll turn and look diagonally, as we do only by 10 months. Okay. Now coming to the last part of our class. I know this has been a big class, but this is a very important chapter. Right, and a very dry chapter too, I understand, don't worry. So, developmental assessment. So, developmental assessment, you just have to know a few names, just get familiar with a few things. So, what are the equipments you need? You need cubes, you need pellets for pincergraphs, red ring for your vision, cubes for your tower, spoon to see spelling, cup and spoon, book to turn pages, crayons to see what they draw, and doll and mirror. So, interpretation, usually when you do a developmental assessment, for term babies, there is a specific window where they should attain the milestone. But preterm babies, you have to give some concession because they are born even before term, no? So a baby who is born at 32 weeks is not like a baby who is born at 40 weeks. So their 1 month means from 32 he has become only 36. But there the 40 baby has become 44. So the development will be a bit lagging. So you give concession till 2 years. So till 2 years you use corrected age. That means for a preterm baby who is 36 weeker, now if he is 2 months now, his corrected age will be 1 month. So if you have a 36 weeker, that means 4 weeks lagging, 1 month lagging. The present chronological age is 2 months. But what is his corrected age? He is lagging in 4 weeks. No. So from 2 months, you minus to 4 weeks, you get 1 month. So his corrected age will be 1 month. Right. Then you have something called the developmental quotient, which is the developmental age by chronological age into 100. So why do you want to know about the developmental quotient? You want to know about the developmental quotient because that tells you how what problem the baby has. Suppose before that we'll just go to a few terms. What is global developmental delay? When there is delay in two or more of the spheres, what are the four spheres I told you? Gross motor, fine motor, language, social. If there is a delay in two or more of these spheres, it is called global developmental delay. So that is closely related with the problem with your brain and your nervous system. What is dissociated developmental delay? When there is a difference in attaining milestones in individual fields. Suppose you have a baby where it could be two situations. One, a situation where there are four spheres, all three spheres are absolutely normal, one sphere is lagging. Or you have a baby where there is some delay in all spheres, but in one sphere there is a lot of delay. So that is also called dissociate. That means it is dissociated from the others. Suppose you take a child who is having an isolated gross motor delay. Language is okay, social is okay, fine. Fine motor maybe some problem, but still a gross motor delay is very predominant. So what do you think will be the problem? Is the problem with the brain? No. In that case, others also would be a problem. No. So there, if you remember when I told first, the systems affected are the next one is musculoskeletal. Could be a problem with the muscles. It could be Duchenne, it could be Becker, it could be SMA, it could be just rickets hypotonia or hypothyroidism hypotonia, hypotonic child. That is why he is not attaining his gross motor milestones. Could be that also, no. So that is called a dissociated development, right? Deviant development means developing out of sequence. Suppose you have a baby. So I told you after sitting only standing comes. Right? Suppose the baby suddenly, even without sitting, starts standing. Some mothers will come to you telling that baby rolled over. After that, he started standing. He did not sit. Okay? They tell it with great pride, but you should be concerned. Because the rule is it will follow the sequence. So this is a deviant development. Suppose the baby without standing, he starts bottom shuffling. On his bottom, he's moving around on his bottom. That is also deviant development. So why is that happening? See, in the first case, it is happening because there is spasticity of the lower limbs. Suppose diplegia. There is increased tone in the lower limbs. If you have to sit, you have to flex your lower limbs. No, that is not happening. You have to flex your hip and your knees. That won't happen in severe spasticity. So as soon as you pull the child, straight away the child will go, even without sitting, straight away the child will go to standing. So that is a deviant development. And then you have regression. Regression means the child has attained milestones and after some time he will start losing it. There are other forms of regression also where there is very slow attainment of milestones. We will not go to that. At your level, regression means the baby has attained some milestones, but after that, suppose the baby started walking, but after some illness or after seizures, now he is not walking, he is not sitting also. So that is regression of milestones. So that happens in some neuroregressive disorders. Now coming back to developmental quotient. Now to know if it is global development or dissociated development, simply you cannot tell like that. Okay, there should be some objective method to tell that there is a delay. And that objective method is your developmental quotient. So it is developmental age by chronological age into 100. And if you get a DQ, if you get a DQ less than 70, it is abnormal. A DQ less than 70 is delay. Okay, because you should give some concession. I told you, sometimes he may walk early, sometimes he may walk a bit late, but both could be normal. So a DQ less than 70. A DQ less than 70 is abnormal. Okay, or delay. So you have to calculate the DQ for each sphere. Gross motor, fine motor, language, development. Suppose see, gross motor, fine motor, language and social. If you have a DQ of 30, 30, 30, 30, this is global developmental delay. If you have a DQ of 30, 90, 90, 90, this is isolated gross motor delay or a dissociative developmental delay. Understand? Right. Now coming to some red flag signs. So what are red flag signs? I told you all milestones need not be attained by all children. Some children will not roll over. Immediately after getting head control, you can sit. They will never roll over. Because it's a soft developmental milestone. Because it is not necessary that the child should attain. But there are few milestones which the child should attain at that time. Otherwise, it is a problem. No visual fixation. No fixation at 2 months. Not vocalizing by 6 months. Not sitting with support by 10 months. Not standing alone or standing without support by 17 to 18 months. Not walking by 18 months. No words by 18 months. No imaginative play by 3 years and lack of comprehension at any age. Okay, that is appropriate for age. So these are the red flags. Now coming to development surveillance. So periodic screening, developmental screening. Anytime you come in contact with a child, you have to do a developmental screening. You can do it with these screening tools, the PETS tool, the Parent Evaluation of Developmental Status, and the ASQ score, Age and Stage Question. The common screening tools used in India are the Patak's Baroda screening test, the Denver developmental screening test, and the Trivandrum developmental screening. The TDSC or the Trivandrum developmental screening chart is something that was made in the CDC Trivandrum, Kerala. So it is a very useful chart. So this is the one of the charts. So it is there for the various milestones, but this is basically for the gross motor milestones. Then you have the fine motor milestones, language and social development. So see, if you have a child who, suppose you have a 40-month-old child, what you do is you keep a scale here, or you keep a pencil here. The child should have attained all the milestones to the left of that pencil or the scale. Okay, so that is how you see. See, suppose this milestone of naming a color. Okay, that starts before 36 months, but it can happen up to 45 months. Okay, so that it's not a delay. If it does not happen at 36 months, does not mean it's delayed. So you keep an object, the child should have attained all milestones to the left of that scale or pencil. So that is a TDSC chart. Patak's Baroda chart, again it was introduced in North India, and then you have the Denver DDST or the Denver scale. The other tests are the CLAMS test, the Goodenough Harrison. Just learn the names. Goodenough Harris drawing test, draw a man test. It's the draw a man test. Goodenough Harrison, draw a man, Harris draw a man. Then you have the Goodenough Harris draw a man test. So that will come to, and you have the SQ3. So Goodenough draw a man test is basically used above 3 years. You give a child a pen and pencil, and you ask the child to draw a person. So very small children will just draw a head. Then he'll draw a body. Okay, so this might be a child. This is, all of us draw such people, no? Then after some time, what happens? Hands come. After sometimes ear come, eyes come, mouth comes, then the neck comes, then the body comes. Okay, then the feet come. So different things keep on adding, and you give points to each of this part, and according to the point you calculate the mental age of the child. So these were all screening tests. Then you have some definitive tests. The common definitive scales are the Bailey scale for infant development, the Welcher scale, that's the intelligence scale, the Stanford Binet scale, and the Vinland adaptive behavior scale. So these are the different age groups. So Bailey scale, Bailey is the most commonly used scale in children, used up to 1 month to 3.5 years. For older children, you have the intelligence scale. So above 5 years, 6 to 17 years, you have the Wechsler's intelligence scale. So the Stanford Binet can be used up to 85 years. It's basically an IQ testing scale. Again, Vinland scale is also used for personal social skills. It can be used even in adults. Now, intellectual, we spoke about developmental quotient. Now we are speaking about intelligence quotient. So, this is mental age by chronological age to 100, and intellectual disability is mild if it is between 51 to 70, moderate between 36 to 50, severe between 21 to 35, and profound between less than 20. So, this is a very common MCQ that you can get. Now coming back to our case, a 2-year-old girl was brought to the OPD, not started walking, term baby, did not cry soon after birth. So this is a perinatal risk factor. Delayed milestones, delayed head control. We told head control will be attained by 3 months and completed by 4 months. Sitting without support at 15 months, that should happen at 8 months. And standing without support only 1 month back, and that should happen by 12 months, 11 to 12 months. She has a squint spasticity. So what's the diagnosis? Basically, there is a perinatal insult, okay, or a postnatal insult. Immediate postnatal insult, did not cry soon after birth. There is developmental delay. There is spasticity. So this could be a case of cerebral palsy, spastic quadriparesis. How will you assess this child? You will do a developmental. We will not go to the other assessments, but here you will do a proper developmental assessment for this child, as we mentioned earlier. So with this, we come to the end of today's class. Now we'll go to a few MCQs. A child of 4 years can do all of the following except skip, tell a story, go downstairs 1 foot per step, copies a triangle. So just tell me what all they do. Tell a story. Yes, they can do. No? 4 years, Anganwadi. Go downstairs 1 foot per step. Yes. 2 things the child cannot do. Skip. Usually they hop by 4 years and skip by about 5 years, and then copying a triangle, that also happens at 5 years. But if you have only one answer to give here, you give copying a triangle. Okay, skip happens from 4 to 5 years. That is why you give copying a triangle. Second MCQ, the red flag sign in child development if not attained, vocalization at 2 months, yes. Walking at 12 months, let it be there. Single word at 12 months, social smile at 6 months. Okay, which is the red flag sign here? Vocalization, if the child has not vocalized at 2 months, is it a delay? No. If the child has not started walking at 12 months, is it a delay? No, it is a normal age. You can go even 13 months is also okay. Not that. 12 months is the time they say 1 to 2 words. So, do you think it is a delay if they have only said 1 word at 12 months? No. So, social smile is usually attained at 2 months. If that has not been attained by 6 months, it's a red flag. And the next question, handedness is established at 12 months, 24 months, 36 months, 48 months. We learned by 4 years the hand preference happens. So with this, we come to the end of today's class. Hope you have understood all about development. I know it is a big topic. There are lots of confusions, but learn it like a story. Just imagine a baby growing, doing things. It will be there in your mind. Thank you.
Docemy.